Let's bring in our panel. Nancy Giles, writer and commentator, Sam Stein, political reporter for the Huffington Post, and also Michael Medved, nationally syndicated radio talk show host. Now, at the beginning of this segment, I talked about the media coverage and the outcry of the people. How in the world could those car executives take those jets to Washington, D.C. and testify? Heck, it costs $20,000 in gas to run those things. Folks, these numbers are staggering. Who can justify, even on my job, $102,000 an hour? And we don't need reform?
And they're denying care to people who pay for it.
Help me out with this one.
I mean, no, there's no justification for it at all. This is a Ponzi scheme. People should be as outraged by this as they were by Bernard Madoff. It's the same thing. You're paying into a system that's not paying you or treating you fairly. And I think that every town hall meeting should start with this kind of information and start with a personal story of a person who's suffering because of their health care insurance the way it stands now. We've got to make these stories personal and like short sound bites, like too much money for not enough cost.
Okay, I've got to tell you, I think this is exactly why your side, according to all the polls and just listening to people, is losing this argument. And I'll tell you why. Because the big concern for most Americans is preserving their own insurance. 85% of the country has insurance. 77% of those people like their insurance. And look, if you can go ahead and put Mr. Helmsley in jail and it isn't going to insure a single other person. But Michael, the question here that people are asking for, Ed, is who is going to pay the bill if you're going to insure 40 million new people with the government?
No, what I want to do is repeal the Bush tax cuts. I'll answer that for you, Michael. I'm not a politician. But you're going to pay more. I'm going to pay more. And that's why it is. Let me get back to this. And we've talked about this before. You're saying that 85% of the American people are happy with their coverage. Wait a minute. Those are the people who have the coverage.
Correct.
We're talking about 50 million people that don't have anything.
You're right.
And 82 million people who have had to go without it at some time or another in the last 2 years. My question is, you say this is attacking the free market and not gouging the consumer. Am I hearing that right, Michael?
No, I'm not saying it's attacking the free market. I'm saying it's attacking Americans where they live. They depend on their insurance. Most Americans get their insurance from work right now. And one of the things that the president, and people understand this, the president is not telling the truth on this. When he says, if you're happy with your insurance, you'll be able to keep it. I had a caller on my radio show today, a small businessman, and he supports the president. And he says one of the reasons he likes the health care reform is because he'll be able to drop insurance for his employees and put them in the government plan.
No, Michael, that's misinformation. The point here is the president has made it very clear, if you like what you have from the Salem radio networks, I don't know what your gig is, you can keep it, my friend. It's not government operated. No one's going to mandate anything to you on that.
However, if you make it to pay for your employer, in other words, what this gentleman was saying to me, and it's absolutely true, under the plans that are coming through the House of Representatives, it will save money, big money, for small business people to drop insurance, put the people on the government plan, and then what they pay into the government is much less than what they were paying to insure their employees.
They don't have to. If they like it, they can keep it. Sam Stein, what's the tightrope the president walks right now with all of these town hall meetings taking place, and there's an image out there that there's an outcry and a pushback that any kind of reform isn't good reform? What do you think?
Well, first off, Ed, welcome back. Secondly, you deserve that $100,000 an hour salary. Thirdly, I think...
Why, just because I have you on all the time?
You deserve more for that. I don't know what they're paying you for that. This is one thing that I was in the White House today at a briefing, and, they're very acutely aware that there is a tightrope that's being walked. They don't necessarily like the idea that they're getting heckled or that the Democratic lawmakers are getting heckled. At the same time, there is a sense that, it's not the worst thing in the world to happen. I mean, there is division within the Democratic caucus over what the proper route for reform is. And as long as the attention is being paid to people like Sarah Palin talking about death squads and euthanasia, then the attention is not being paid to the frictions within the Democratic Party. One other thing, this Robert Greenwald video is exactly what Democrats are trying to do, which is set up the enemy. There hasn't been an enemy for the Democratic Party to attack in this whole health care debate. They're switching it to health insurance reform. They're talking about, protect protections for consumers. This is the type of messaging that works. They know it works, and this is going to...
And Sam, it's real stuff. And I want to point out about these town hall meetings, these aren't young people. The 20-somethings and the 30-somethings and the 40-somethings, they're not showing up. These are all watching the other channel, getting all nervous about where this is all going. And the irony of this is the very people the president is trying to help are the people that are showing up, taking the bullet points and being the anti. It just amazes me. All right.